Aidan, today's session. Over to you.
Thank you very much, and welcome everyone. If you do have any questions or would like to kind of comment but don't want it recorded, we will be turning the recording off after I've sort of finished my presentation, and that'll give you the opportunity to speak more freely without it being recorded. So without further ado, I'm going to share my screen. So today's presentation is going to be on medical gaslighting. However, I also want to discuss a little bit about gaslighting in terms of medical conditions in everyday lives, in your personal lives, in your workplace, etc. Throughout this presentation, I'm also going to give you some of my own personal experiences, my lived experiences of encountering medical gaslighting and gaslighting in my own personal life. Feel free, as we've said before, to put some comments in the chat, to ask any questions, etc. as we go along. I unfortunately cannot see the chat, so Neve, are you able to sort of just shout at me if there is anything in there, please?
Yep, that's fine.
So I want us to start off and thinking, I like playing a little bit of a game to start off with. We're going to play bingo. When we're looking at medical gaslighting, I would like to find out how many of these statements that you might have heard from a medical professional, whether that be a doctor, a consultant, a nurse, physio, OT, whoever it may be. Have you heard of any of these statements or some? It's all in your head. You are just imagining it. You are too young to be ill. You are such a hypochondriac, you're attention seeking. It can't be that bad. You can't expect everyone to change just for you. Why is it always about your disability? Using Dr. Google again. Maybe you're not trying hard enough. You need to be more positive. You don't look disabled. You'd be fine if you just ate better and exercised more. Everybody gets tired. It's just your anxiety and depression. Come back when you've lost some weight. You are too sensitive to pain. These are often phrases that are representative of medical gaslighting, of gaslighting in everyday life. You may have heard of some of these. I like to say it's something similar. If you even take one of these, okay, or you know of somebody, for example, your parents or your children or your friends, this is all indicative of a sign of medical gaslighting. As we go through this sort of presentation, I want you to keep in mind some of these statements. Keep in mind and reflect on how it's been for you, or how somebody is by yourselves, or your family, friends, etc. Sometimes when we hear this term medical gaslighting or gaslighting itself, we don't understand the implications. It isn't until we've had this sort of education, this awareness of going, oh yeah, that's happened to me, or that happened with my child. So as we go along, if you do notice that any of these kind of comments are things that you've experienced in your life, please be aware that medical gaslighting is a form of abuse. It can lead to unhealed trauma. If at any point you do need to leave, or you feel like this has just sort of hit your point of unsure or shock, feel free to leave. I'm not going to be offended if you disappear off. Okay. It is just that point of it might be something that comes to you and you suddenly might have that experience. Okay. So what do we actually mean by the term gaslighting? Gaslighting has been quite common in about the past 10 years, pushing through in terms of the media, social media, etc. But what does this actual definition stand for? Well, it's the act or practice of grossly misleading someone, especially for one's own advantage. It is a psychological manipulation of a person, usually over extended periods, where it causes the victim to question the validity of their own thoughts, their reality, memory, and it can also lead to this emotional or mental instability and dependency on the perpetrator. Within this, we could see it's often over this extended period of time. Sometimes it can be just sort of one-offs. Okay, it doesn't have to just be that extended period of time. And as I said, it is a manipulative tactic. It can occur at all points in your life, whether that be medical, personal, social. It can occur in education contexts. It can occur in the workplace. In terms of, I'm just going to use an example from like sort of my personal experiences. For those of you who do not know, I have a So what happens is I have nerve compressions throughout both of my arms, which means that the sort of muscle, the fascia, etc., are all kind of crushing the nerve. I've had 6 operations in 6 years, the most recent one being in early December. It leads to chronic pain. I have struggled gripping sometimes. I have repeatedly dropped crockery. And because of this, I wasn't actually diagnosed until about 6 or 7 years ago. I encountered this pain, these symptoms when I was 10 years old. Just for a little bit of context, that is 19 years ago. And obviously, I went through secondary school, my GCSEs, my A levels, my undergraduate, my doctorate. All of those times I was in a lot of pain. I hadn't got a diagnosis. A lot of I went to 8 specialists from different sort of backgrounds. I saw about 3 or 4 physiotherapists, 2 OTs. I saw an osteopath. I've had X-rays, MRIs, ultrasounds, you name it, I've had it. I've seen both on NHS and private, somewhere paying around the price of a small car over the years in fees just to be able to get a diagnosis. But because nobody can see pain as such, nobody could understand the reason why I was dropping things. In sort of my education context, I had teachers coming to me and saying that, there was nothing wrong with me, just get on, or you were doing fine yesterday, why can't you do it today? I had a lot of emotional abuse during my sort of secondary school. I am PE and sporty, but my sort of PE teachers didn't recognise that and didn't understand and have that compassion for me when I was trying to tell them I had a disability because I didn't have that diagnosis. Now, thankfully, we are now years later, but as we've gone along, as I've seen so many specialists, etc., I've had a lot of gaslighting throughout that time in my personal life and through medical. So I'm going to give you a couple more examples as we go along here. But what is the actual history of gaslighting? Okay, I said it's happened quite more dominant in media and in social media in the past sort of 10 years or so. It hit psychology and academia in terms of psychology in about the 60s, but the actual term gaslight is way before that. And it actually came about through the play called Gaslight, ironically enough, by British novelist and playwright Patrick Hamilton. It was subsequently produced as films for the UK and the US with some very famous names for you there. If you are very much into sort of black and white films, I strongly suggest that you go and watch one of these. The US remake had a bit more of a loosely based on rather than the actual UK film, but all of which has this same point of where this term came from, the approximate storyline. So I want to give you a little bit of an idea of where this story came from. Picture it. It is 1880. London, it's quite foggy and late afternoon. We are introduced to Jack Manningham, who is a bit of an overbearing husband. He likes to flirt with the servants in front of his new wife, Bella. And they live in an upper middle class house. The apartment above them is currently empty. It was housing a woman who was very wealthy. Unfortunately, she was killed for her jewels, but the jewels were never recovered, and nor was the murderer found. Throughout the play and film, Jack starts to have some manipulative tactics over his wife, Bella. He disappears from the house, but doesn't tell her where he's going. The empty apartment upstairs, there's footsteps, all of which Jack claims that Bella is hearing things. He uses the gas-fueled lights in the apartment, which dims the entire house, but he vehemently denies doing so. Through all of these sort of manipulation tactics, Bella is questioning her own perception of reality. And that is where the sort of gaslight terminology is coming from. I'm not going to spoil the ending. There is obviously a murder mystery, jewels to be solved, and everything else. I strongly recommend the films. But overall, that is where we are looking at in terms of the history of the gaslighting. So we've got this understanding of what is gaslighting. Now let's put it into a bit more of a medical context. Well, it is the form of an emotional abuse enacted by a medical professional on their patient. Again, I'd like to reiterate with medical professional, it could be anyone within the medical field. Okay, we do not just have to see it as doctors, nurses, etc. Think of it physios, OTs, chiropractors, etc., etc. It involves an intentional pattern of denial of someone's emotions and memories. So there's 6 types of gaslighting, and I'm going to explain sort of each one. But before I do that, I'm going to give you another sort of personal lived experience. As I go through my experience and we go through the types of gaslighting, I want you to try and see which ones that I've encountered. Okay, see if you can sort of relate some of them to what I've encountered, but also have there been any that have happened to you or someone that you know. I already mentioned about my sort of medical condition. Well, when I was 15, we're starting to get to this point of there is something wrong. I'm hitting my GCSEs. It's not just a repetitive strain injury, there is something there. So I went and saw a professor who is one of the leading experts in the UK. Okay. Anecdotally enough, was it just so happened to be on the day of my grandmother's funeral. So we went in the morning to see the doctor for the funeral in the afternoon. So you can imagine it, my mum, my dad, and myself turning up all in black. Very interesting kind of approach. But when we got there, his sort of discussion to me, my testing, the diagnoses, he grabbed my hand and he bent my hand forward and back and then declared that nothing was wrong with me. But just to be safe, I had an x-ray, came back. I also had bloods, came back, nothing was really found. And then he sat there and you could tell from his face that he didn't want to say anything, but he had something really important to say. He refused to talk to me about my own condition. So I made the decision of going out the room so at the very least he could tell my mum what was going on. Now at 15, you're starting to think, oh my goodness, I'm dying. He doesn't want to break the news to me. When I'm out the room, he turns around to my mum and went, she's making it all up. She is attention seeking. Girls her age always come to me with this kind of problem. They make it up. They want sympathy from their parents. She probably wants something off you. Well, none of you know my mum, but my mum is highly protective of me, being an only child and whatnot. And this really upset her because he then had a go at her for bringing me along, for actually allowing me to manipulate her into this sort of situation where bringing it to him being, one of the leading experts, it was a bit below his needs. It was very much a go away. That was just the start of my long journey through the medical profession. But based on that story, let's look at some of these types of medical gaslighting and again, see if you can identify some of the ones that I had. So one of the main types is when someone makes you question your memory. It could be that you've gone in and said, this happened in May, and then the next time you see them, you say it happened in June, and they start to question that and they go into it and then start going, oh, we don't believe you, you're making it up because you haven't quite got your timings and dates right. It might be about withholding. They refuse to engage in a conversation with you. They might belittle you or disregard your feelings or experiences, making it seem less important or complex. There is often an element of stereotyping, where it could be biases about your gender, race, ethnicity, sexuality, country, or age. They may assume that the diagnosis on this based without tests. Could be denying that what has happened to you, making you start to think you're crazy or lying or that you're imagining it. They may, as a result, refuse to do any tests. Or they may sort of divert, try and change the focus, doubt your credibility, blame your symptoms on something else, mental illness, for example. It could be, go away, you need to lose weight, etc. So these are sort of the 6 types of gaslighting. Some of them, as you can probably tell, overlap slightly, but those are the ones that we kind of need to focus on. So how does medical gaslighting actually happen? Well, this might be due to the professional's lack of awareness of a condition or illness. Okay, we're not expecting everybody to be an expert on everything. So it might be that they have this lack of awareness of it, and therefore they believe they're not trying to show you that they don't know. Okay, that they are trying to state that you don't have a condition or illness because they don't know it. There might be an unwillingness to consider options beyond what they typically see. I've got in brackets here horses and zebras. Seems to be an analogy within the medical field that a horse is a very common illness or condition. Zebras, obviously, they still exist, but they're a bit more rarer. There might be some preconceived judgments applied. Again, this could be towards sort of stereotyping. They might have an ego, very much like in my situation, that they're unwilling to accept or reveal their lack of knowledge. And it can be a form of institutionalized misogyny, sexism, racism, etc. Earlier on, we did a little bit of a bingo about some of the common phrases that you might have heard. I'm going to give you a few more. So this one that I keep repeating, and very much the title of this presentation, it is all in your head. This assumption that whatever the condition, your complaint, etc., is not real. You're inventing symptoms, you're trying to get attention, all these kind of blaming elements there. It can't be that bad. People faint every day. Change the word faint to some other phrase for you. where this is where they're very much downplaying the symptoms, pretending that everything is normal. Yes, I faint 5 or 6 times a day. Oh, that's completely normal. Everybody does. All those kind of making you deny and question your reality. It's just period pain. You just have heavy, painful periods. Again, that assumption that a period problem is normal. One of the sort of conversations that I've had with other people, we need to think about it in terms of some conditions have a long diagnosis because of some of these conditions. The period one reminds me quite heavily of endometriosis. There is something like an 8-year on average wait before somebody is actually diagnosed with endometriosis, because there's often this delay due to comments such as this: it's heavy or painful periods, there's a lot more tests run, or that pain that you have, it's just something else. All those kind of aspects of diversion mean that a condition such as endometriosis takes a long time to be diagnosed. It's likewise with other conditions as well. I think ME is one of the big ones as well. Blaming it again on it's just stress. Have you improved your diet and exercise? Have you tried yoga recently, or Pilates? That seems to be a very common one. So again, basing that assumption on your weight or being very stress related. I, being more of a heavier weighted person, I've often had it as my condition will do a lot better if I go and lose weight. My background in sort of PE and sport, I concur. There is elements there that I could do better with terms of my exercise and my weight, etc. But sometimes my pain stops me from exercising. It actually turned out that as I was trying to build up the strength in my arms, it actually caused my muscles to be tighter and caused some of the nerve compressions to be a lot worse. So for me, doing exercise, although is beneficial in the long run, for my actual condition itself, it meant that it was very detrimental to me. And I still now have to balance my exercise with sort of what I'm doing because of my condition. You are too young for that. This assumption that young people don't get sick. You need to try at least one more, and then whatever it might be. So repeatedly pushing you on a treatment path that might not be working. Are you sure you're not exaggerating? So you often have to defend your position. You doubt yourself. All of these, not believing someone who is chronically sick, telling them it can't be bad, asking them to prove it, is not respectful. It is a form of abuse. Please remember that. We've sort of seen some of the comments about the signs of medical gaslighting, but I want to give you a few more. So it might be that your doctor's not engaged in listening to you, will not discuss your concerns. You might feel very rushed, frequently interrupted, not giving the opportunity to explain what you're experiencing. The professional might downplay your symptoms. The medical professional might appear rude, condescending, belittling, etc. Often blamed on some form of mental health issue. Your diagnosis is assumed based on your gender, weight, race, ethnicity, sexuality, etc. Having your concerns invalidated when you are vulnerable or in pain, ill, etc. Feeling intimidated or bullied to the choices that you're making. Feeling disempowered, so that again you agree to the procedures or the treatments even though you don't feel comfortable with it. It may even at this point you don't feel comfortable with the medical professional themselves. You don't want to be in the room with them. You often leave appointments feeling scared, or people not believing that you're not taking your health seriously. It may also feel scared when you're coming to the hospital or doctors, etc. You get that anxiety. You're refused any further tests or investigations or imaging. The medical professional gets very defensive about you getting a second opinion. You feel ashamed or embarrassed about seeking care. That's a very big one, especially if it is in an intimate part of your body. Okay, we already have that sort of embarrassment sometimes with it being in an intimate part of your body, but you might feel more so in this case. So I've gone through what gaslighting is, what medical gaslighting is, some of the signs, etc. But we also have to consider who are the main groups or some of the groups who are often affected by this. And I very much like this picture as an example of this. So I've divided it up, and I want to also point out here there is intersectionality aspects as well. It is not just these factors. Think about that term of with race and gender coming in, with sexuality and gender, within sexuality and race, etc. All these elements having that intersectionality. So more likely, if you are a woman, to be systematically dismissed, not believed, or your reality questioned. If you are Black or in other racialized groups, again, you're more susceptible to being medically gaslighted or gaslit. I'm not quite sure. If your sexuality is within the LGBTQ plus community, I also want to point out here individuals who are transgender or non-binary more so. If your appearance is overweight or obese, anyone with a disability, anyone who has a chronic illness or condition, particularly those that are not recognised or doctors don't know of, and your age. Medical gaslighting can happen to anyone at any age, but often we see medical gaslighting happening to children because of that belief they're making it up, or older and elderly people. It can lead to unrecognised and unhealed trauma in an individual. If you would like more information about this, I strongly recommend you go and have a look about the trauma implications on individuals, especially if any of you in this room are within the health sciences and wellbeing, the medical school, etc. I found this quote online and I really, really like it. Okay. If you do not know the etiology of a patient's symptoms, have enough humility to admit this, validate their concerns, and refer them to a physician who may be able to help. Medical narcissism is dangerous. This routine dismissal of patients' concerns is driving them in desperation to seek care from predatory practitioners, or worse, delaying a diagnosis and causing irreparable harm. We must do better. So why do we teach about medical gaslighting? Why should we encourage our medical school, our medical professionals at the universities to start teaching about medical gaslighting? Well, first and foremost, it is a large problem faced by many people. Okay, I am just one example sat in this room. I've had it done to me repeatedly throughout my life. Okay, it's probably happened or is likely to have happened to at least one other person sat in this room. It can happen repeatedly, or it can happen over a long period of time and can lead to that medical trauma. I absolutely hate going to a hospital because of everything that's happened to me. I don't quite get sort of an anxiety attack, but I am sort of bordering on it, especially when I know or don't know the person that I'm going to see. I've seen my current physician for about 7 years, and he's the one that's done 6 operations on me. I have built a trust with him. Other ones, when I'm told to go see someone about whatever, my eyes, my head, my leg, I get this sort of massive panic. I have a build up for it. I have to take like the day off work, even if the appointment is only sort of at lunchtime and I could pop out, because I need to prepare myself before even facing this individual. I end up writing sort of an essay of notes ready to take in with me, so that if I get to that point of not being able to talk, I can almost thrust a piece of paper that explains what's up with me. That is where you start to see this kind of aspect of medical trauma. My mum is very much the same. I think that's part of one of the aspects of her being so protective of me, that she, and she's fine with me to talk about this, but she had breast cancer when I was 7, and she's had endometriosis. She's had quite a lot of sort of women health problems coming through. And one of the things that a medical professional did was they just sort of grabbed her arm and stuck a needle in it when they needed to do something. There was no discussion of, right, we're going to just do this. This is what we plan to do. They just grabbed her and stabbed her with the needle. As such, she has needle phobia. When it was the COVID vaccinations, you could see she was practically trembling in the buildings. We were having to sort of hold on to her. She didn't faint or anything like that, but it was very worked up of having to take, for her, the whole week off just to build up to it. She needed sort of holding and being really sort of cuddled when she were having the injections. Something like that. It's a sort of blip of a moment of within her life that has caused her to have this massive phobia then of needles and anyone coming near her. She does it very much with any medical professional who enters the room or is talking to her. She has to tell them, stop, you need to explain to me what you are going to do, give me full details, etc. I need you to go, this is what I'm going to do, this is when I'm going to start. Are you ready for me to start? Are you ready for me to finish? All that kind of step by step kind of support and feeling is what is needed because of this trauma that she has. And as a result, she has this self-doubt, this distrust with any medical professional. We often sort of feel then isolated, confused. We lose our confidence when we are engaging with any form of medical professional. This anxiety, this fear when we're going to a doctor's appointment, for example, like I've mentioned with mine and with my mum's. Because of it, we can have this misdiagnosis, mistreatment, delayed diagnosis, treatment. For mine, it took something like 12, 13 years before someone diagnosed what was wrong with me, because there was a lot of go away, there's nothing wrong with you, you're attention seeking. As such, 12, 13 has built up so much that even though the operation itself has been a success, I can still feel pain because the pain pathways are built so strongly. Alternative reasons for symptoms are not considered or diagnosed. Aspects of consultation may not be recorded. Implementing education, discussions such as this, discussions within the university and with our medical students, all helps give that patient perspective to be considered. It allows us to develop practitioners at the university who are competent, who are caring, who are compassionate, have empathy for individuals who are coming to see them. All of these are strong things that I hope is going on with our medical school, etc., and is something that this can be a long-lasting legacy at the university. It might be that the person needs to try alternative, unproven approaches. It might be that there is this awareness of how to avoid progress that cannot be made. I'm just very conscious of time here, so I'm going to sort of kick on. Coping with medical appointments. I have this anxiety about going to see even just sort of my normal GP. Okay, here's some sort of like strategies that may be able to help. Ask what is the differential diagnosis. Ask if it's sort of been ruled out. Have there been the proper tests? What evidence is there for and against that differential diagnosis? Has this information been documented in your records? Have trust, someone you trust with you at your medical appointments, whether that be a friend, your significant other, whether it may be anyone you sort of know, have someone with you that you feel comfortable with within your medical appointment. I know there is the option in sort of medical professionals to have sort of that chaperone, as being another nurse, doctor, whoever. But if you have that built up medical trauma, you might not feel comfortable having them in the room. Bring someone that you feel that you can trust, who is willing to be able to stand up for you and advocate for you if you're not able to do so. Might have seen there's this ad from Nurofen called See My Pain. It's a very interesting ad. It's starting to raise this awareness about kind of medical gaslighting and bias within the medical profession. I strongly recommend that you look at it in more detail. The link is in the very end of this presentation. It is a free tool designed to help you tackle bias and have a constructive conversation with your healthcare provider. It allows you to track your pain, record your symptoms, learn what to do when you're facing bias. It is another strategy to help cope with medical appointments. Again, what can you do? If the medical professional refuses you a test or imaging, ask them to note their refusal in your notes. If it goes to somebody else, another professional will be able to see that refusal then. Keep a record of everything, right, that sort of the doctor says, even if it sort of discusses that gaslighting, what was said, how you felt, any follow-up, okay, you might need that evidence. Trust your instincts. You know your body. Okay? No one else can know your body for you. If you feel there is something wrong with what is happening with you, what is happening in that interaction, trust your instincts. Go in there and get the support that you need. If you feel able, tell the doctor, have that constructive conversation with them. They might be open to it. If they are, get them to talk about, how their behavior is affecting you. You might be able to make that change, make them aware of that change. If needed, get a second opinion. Okay. If the doctor's behavior is severe, report them to the supervisor or regulatory body. Okay. Reporting their behavior can help protect others from experiencing the same treatment. Remember that it might not just be you who it's happening to. It might be more than one person, and the more people sort of that stand up, we can get this sort of behavior looked at and explored. I've talked all about medical gaslighting. I want to sort of keep that idea to just one side, but know that gaslighting can happen in everyday life, especially for someone who has a disability, long-term health condition, is ill. Okay, I found this sort of comment: "You don't look sick," but I am sick. This is how sick looks. Okay, being sick, being ill, being in pain is often misrepresented and underrepresented. Okay, I can still have a laugh, I can still have a joke, I can still do things, but I might not be able to do them all the time. You only see people in the workplace for a set period of time. You don't see them often in what happens when they go home. It might be that they've had such a really long day, really bad day, the pain's got to them, and they've gone home and they've put a big smile on their face during the workday, and they've gone home and curled up into bed and cried. Okay, that has happened to me. I have happened to spend my entire day laughing and joking with my colleagues, but as soon as I've shut myself in my home, I've collapsed and cried my head off, because I've been in that much pain that I have masked my disability throughout the entire day because of having this approach that I cannot look like I'm sick. I cannot look like I am in trouble, or there is something wrong, I am weak, all those sorts of personal emotional feelings that you might have. One of the really big ones for me in my hands is I'm going to the supermarket. You know, you put everything into the bags, you load it into your car. Well, I'm going to say normal people, able-bodied people find that relatively easily. For me, I find it quite difficult. Some days I can't lift that supermarket bag into my car, other days I can. Some days I then just can't even drive home. I went to the gym recently and had such a bad time at the gym that I'd almost pushed myself a little too far that day, and I couldn't drive home. I had to call somebody to come and pick me up and come pick my car up because I'd got to that point. So it's not just this element of everybody looks fine. You do not know what is going on behind closed doors, behind that mask. And it's always to be bearing that in mind. So when we look at gaslighting, we can end up gaslighting people we meet. And this can occur by our everyday acquaintances, okay, asking very personal questions. It can be strangers, work colleagues, your friends, family members, teachers, etc. One of the things it could be is that, you know, you repeatedly tell your friend that you can't come out with them. You know, all your friends are going out all the time, all the time, all the time, but you can't do it because you're not able to go out and have that social life sometimes. And they think, you know, you're just making it up, or, you know, you're a bit of that sort of friend that never does anything. It might be because of your condition. So things that we can do to avoid this, okay? How can we sort of support and think about our friends, our colleagues, our neighbours, etc.? One of the things that we need to avoid doing is making suggestions. A person with a disability has often tried as many things as they can to make their life easier. Making the suggestions, it might be that you're trying to think of it as a very friendly, helpful thing, but it can actually be quite detrimental because we might have already tried this, and you going, oh yeah, have you tried yoga? Have you done this? Have you done that? Might feel very negative on a person with disability. It might start gets frustrations. I mentioned exercise before. Yeah, it's a good thing, but some people doing exercise, it can be very detrimental to their health. If we think about things like ME and chronic fatigue syndrome. Alternative medicines. Some companies take advantage of this. Okay. We might have tried the vitamins, minerals, and in its various forms. We might have tried this different brand. Try and think about it in just sort of supporting an individual. Intrusiveness. I think one of the good things about the university is we actually avoid this. This is actually something that we're doing really, really well. We don't demand this sort of personal information, particularly I've noticed in sort of the Enable network, in our staff networks such as Pride, etc. It can be entirely private. You don't know what's happening in someone and their body. They might have that trauma. An individual does not owe you this information. Okay, so keep going into that thinking of don't be intrusive into their lives. Grief. Avoid saying how lucky the person is not working, or if they, you know, have done this, and look at how lucky you are, look at everything you've achieved. Often a chronic health condition involves a lot of loss and sacrifice of who they are, their capabilities, what their future might hold. Within sort of mine, I currently work part-time. I have this sort of unknown knowledge if I would ever actually be able to do a full-time job because of my disability causing me that much pain and grief. I would love to sort of work full-time, like, because that seems normal. But my health condition is sort of causing me to not think about it and think about, actually, will I even be able to manage? Will I end up just having a burnout like I did a few weeks ago? Okay. So these are things that we can avoid doing. When you're sort of meeting people, talking with them, remember age is not a factor. Some people might not even have a diagnosis, or it might come later in life. Not all disabilities are visible. Variability happens. One day I may be able to do something, the next I may not, because of my symptoms. It can occur on different degrees on different days. I'm very conscious of time here, so I'm going to sort of speed up here. All right. Overall, be kind. One of the big things about having a disability, etc., you don't want people to tell you what you should and shouldn't do. What you want is someone to go, how can I help you? What can I do for you today? Is there something you need from me? That, honestly, if I've heard that from someone I work with, I will be in tears of happy tears. Okay, what can I do for you today? Especially if they know that I'm struggling. I've mentioned the sort of slides are on, Neve's handed the slides over, so feel free to sort of go through these a little bit more. And I want us to kind of finish off with a few things to remember. You have the right to receive respectful and ethical care. Your pain, your condition is valid. You're the one who knows your body best. You are the most reliable narrator of your own experiences. Be kind. And this leads me into this last thought. I wish more people deeply understood that being able-bodied is temporary. If you are interested in this discussion, medical gaslighting, and a bit more, I'm more than happy to have a chat with you in the next sort of 10 minutes or another day. Or if you want to learn a little bit more about it, there are lots of sort of links and references there for you. Feel free to go away and look up about it in more detail. Thank you very much for listening. I'll stop sharing my screen and